Everyone has come. Please keep your cameras on. Yeah. All of you, thumbs up if you are ready. Okay, I'll begin now. Yeah. We had done lymphatic system and the lymphatic circulation as a part of extension of the cardiovascular system, isn't it? So, and why is lymph? What do you know about lymph? So, lymph is an interface between immune system, circulatory system, and your digestive system, nervous system. In fact, all the systems that can, where there is circulation and need for immune functions. In all the systems that you have studied till now, right? So, what is lymph? Lymph is nothing but the tissue fluid which comes out at the arterial end and is again reabsorbed in the venous end, right? Is it clear to you? And have you heard of the word chyle? Chyle. What is chyle? It is lymph, is nothing but lymph from the digestive tract, right? Which has got lot of flat globules and proteins. And how do this lymph function in the immune system? The lymphatic capillaries then drain into the subclavian vein, right? And then into the internal jugular vein via the thoracic duct when the lymph is collected from the upper body and from the digestive tract through the cisterna chyli, right? And there are two primary lymphoid organs. I hope you remember about your lymphocytes. Anyone who doesn't remember about on your lymphocytes? Where are these lymphocytes generated? Where are these lymphocytes generated? Take a minute, unmute yourself and tell me quickly.
Bone marrow and spleen.
Wait, bone marrow is right, but spleen is not right.
Thymus.
Good. We have two types of lymphoid organs, primary and secondary. Primary lymphoid organs are only two. Please remember, primary lymphoid organs where these immune cells are generated are only two, the bone marrow and the thymus, right? Where they are matured. And the secondary lymph tissue are the spleen, lymph nodes, which have efferent lymphatic and efferent lymphatic, and which occur as a group of lymphoid tissue near in the circulatory pathway. What they do? They serve as filter. Okay? They serve as filter, and in those lymph nodes, your debris, tissue fluid, antigens are collected. Okay? I'll give you the slides. You can go over it. I want to finish this fast. And you can see there are two types of lymphatics, right? The lacteals, which are also called the lacteals. Now, lymphoid tissue is again primary lymphoid organ, which is the other one is the bone marrow. So, but the structure I'm not going to tell you now because you have done it in the anatomy. So, this is for your self-study. There are 7 types of epithelial cells in the thymus, right? 7 types of cells in the epithelium. When there are so many epithelial cells, variety of epithelial cells, obviously their function will also be different. This is again for you to find out. Okay? So what other cells they have apart from epithelium? They have lymphocytes, they have which they generate and they process. They have macrophages, okay? They have corpuscular hustles, right? And you have to know more about these because this will be, have you done lymph organs in histology? Anyone? Please unmute and tell me, right? What are the functions of this lymphoid tissue? Development of T cells and development of B cells?
No, ma'am.
No? Then you can ask your teacher, just tell you something about the histology, right? And we also have, in animals, this is very highly developed, not in so much in females. And there is a blood thymic barrier. You have heard about the blood brain barrier, right? But there is also a blood thymic barrier where blood cannot enter the thymus. It has to, the efferent has to be the afferent has to be via a lacteal or the lymphatic, which enter as afferent and which will go out as efferent. After filtering the lymph at the spleen and the other lymph glands. Where are the lymph glands, by the way? Can you tell, one of you can tell me? Unmute yourself and tell me. Do you have lymph glands? This thymus is very well developed in children and in animals. Why? It is, in adult, it is almost atrophied, right? The cortex, which is consists of the epithelial part, is almost atrophied. It's only the medulla which persists. So why the cortex should be atrophied in adults, and why the medulla should persist? This is again for you to find out, right? And there are something called thymic hormones. What are they and how they are produced? This also you have to find out yourself. Now, when I talk about immunity, there are certain diseases where there will be thymic aplasia or when there will be thymic hyperplasia, right? Say in chronic disorders, there will be inflammation and your lymph glands will be enlarged. Have you ever had like this experience where your lymph glands are bigger, right? So there is this in some autoimmune diseases when there is a overwhelming infection, lymph glands or the thymus usually is destroyed or it is surgically removed, especially when the children have tonsillitis, they have difficulty in breathing, even the tonsils. If you have tonsillectomy, how many of you have tonsillectomy? I am sure some of you have done tonsillectomy, right? So all this has implication on your immune system. So lymphoid tissues are two types, diffuse and dense. Diffuse are plasma cells and diffusely arranged lymphocytes, which are again, they are generated in the primary lymphoid organs, and dense are again discrete or it can be mucosa associated that is present in the lymphoid tissue is present in the mucous lining, that is in the gut or in the bowels or in the mucosa of large intestine, bronchi or the urinary tract. Okay. So lymph nodes are secondary lymphoid tissue. They are encapsulated and they occur in the path of lymphatics, either single or in groups. We have here, when you have tuberculosis or other infections where the bacterial debris, bacterial toxins are drained into these glands, filtered at these glands. If your lymphatic supply is sluggish, then they remain here and there is inflammation, right? So they are in the neck, submandibular region here, axilla and inguinal region. Then spleen is also a lymph node, actually the biggest lymph node, where these are again filtered. So in chronic malaria, in Kala-Azar, you will see the spleen is huge one. And it's so huge that the blood supply is compromised and they have to remove the spleen, which again leaves a patient vulnerable for other infections. In each lymph node, there is an efferent and an afferent lymphatic. The afferent lymphatic brings in the toxins or the debris or anything which effuses out into the tissue fluid from the arterial end of circulation and filtered and then finally filtered lymphatics, filtered lymph or the chyle is uh, kind of sent to the vein through efferent lymphatics. The structure again I leave on to you because you will be doing in histology and in anatomy. Histology of spleen is done very thoroughly in anatomy, right? You have to know about efferent and afferent lymphatics of the spleen, what happens in enlarged spleen, in which clinical conditions, which are the cells which are hypertrophied, and the functions of the spleen. Functions of these is primarily filtration. So what is the significance? This is the last slide I'm presenting to you. Before I give you some assignments, I'll be sending this presentation over to you by Google Classroom. Can you see this? Whatever I have written here is for you to find out and study before doing the assignments, right? So what is the significance of lymph and lymph flow? It cleans the tissue fluid of the debris. In the arterial end, in the capillaries where there is sluggish flow for filtration and uptake of oxygen, right? There's some tissue fluid that oozes out, which also is kind of contains the dirt and the toxins, metabolites, debris, and all of that. Also, the bacterial remnants, the viral capsular remnants like present COVID also. Therefore, you can see even after having the infection twice, thrice, people are still having it because their lymphatics are not very robust. Why not robust? Because there is no pump. We have a pump to give the arterial supply to every nook and corner of the blood. We have the vein Kessel vessels. We have mechanisms in place. For the veins, we have the calf muscle, right? But to clean, we do not have any pump, and therefore the lymph flows very, very sluggishly. But it is very important that this should be made robust, right? The lymphatic circulation has to be increased if you want to clear your system of your metabolites, of toxins, and you have to remain fresh. People who do not have a robust lymphatic supply are kind of low in inertia, not energetic, right? Don't want to work, don't want to study, right? So you have to, that depends on you if you will like to increase your lymphatic circulation. You have to implement the measures to increase the lymphatic circulation. How do you do it? You do it on its own. It happens by the muscles that pump around the lymphatic circulation, right? That will get the fluid to go. But otherwise that means it needs milking of the lymphatic channels. You know what is milking? Milking means this is if the flow is towards one direction, you just put your two fingers on the vessel, and with this, it is, say if the flow is on this direction, you have to press it and block the flow, and with this finger, you have to milk it, right? Push the flow so that it is a vacuum, and so the vacuum cannot exist. As soon as you leave this finger, the forward flow happens. This is also you will be doing in general examination when you see engorged veins. You will see in some patients veins are engorged, especially in upper chest, legs, in varicose veins, or ascites, cirrhosis on the abdomen. So you have to decide which side is the flow. So this is the sign, milking, okay? You just push You just block the flow with one finger. With the other finger, you milk it away. You push the flow away so that in that part of the vessel, it's devoid of any lymphatics or blood or whatever. And when you leave this finger off, therefore forward flow of the lymph happens to accommodate the vacuum created. Okay, fine. So then it is done. What is the function? Processing of the debris, including toxins, metabolites, bacterial and viral remnants in lymph glands. Therefore, it is not very advisable to be on bed when you have some infection. It is always advisable to move your muscles so that your lymphatics are also kind of go on pumping, right? So, how can we increase? We need some exercises, muscular movement, exercises starting from muscular movement, which will increase the flow. Massage, any vibration that moves these muscles. And then, of course, sorry for the mistake, standing alternately on heels and toes, right? On toes, heels, right? Like this. Heels, heels, toes. You you can do sets of that in the afternoon, in the morning, so that your lymphatics um, are not stagnant, right? Constant shrugging, right? Do it as exercise. Shrugging alternate shoulders or both shoulders together, right? Rotation of the shoulders. These are not, these are, these are exercises just enough to move the muscles covering the lymphatics, right? Then pulling and rotating the ears. Many of you must have got punishment, pull your ears and sit down, isn't it? Pull your ears and kneel down. So these are actually maneuvers to lift you out of the inertia, right? Which is the least used muscle? It's the ears. Human beings don't have big ears like elephants and dogs, which constantly go on flapping. Our ears, we do not move. It's very small. So you have to exercise that part of the muscle because most of the lymph glands are in this post-auricular lymph glands, submandibular lymph glands are in the ears, right? Behind the ears or in front of the ears. So, and all this from the upper part of the chest, upper part of the lungs, all the debris come and accumulate in these lymph glands. Therefore, it is very important. Is it clear to you? Show me a thumbs up if it is clear to you. All of you. If it is not, you can ask me any questions right now. We have some time. Unmute yourself. Ask any questions. Any questions you have? Yes or no? No, show like this. Yes, show like this. Yes. No questions? I take there are no questions. Can I proceed?
Yes, ma'am.
Okay, fine. I have checked all your test assignments. Would you like to know my feedback?
Yes, ma'am.
You have done your work. Yes,
Yes,
you
ma'am.
have done your work. But doing is not alone. I mean, you cannot just do alone. You are the person that does the work. So how you do your work, you have to emerge your qualities that this is the person which has done the work. Okay? The work per se does not make any meaning. There's that we can see, if we want to know, we can consult any book. And as teachers, we don't need to. These assignments are given to you so that your qualities which you should imbibe, which you should emerge to be a doctor, is strengthened from now on. Is it clear to all of you? Some of you have taken recourse to consult Google search or asked your friends, during the test. This is very obvious to us and we can find out. You are not fooling us, you are fooling yourself. Okay? You are fooling yourself. At this rate, you are not going to have the qualities of the MBBS student has. Okay? About the logbook also the same thing. So please understand all the instructions that is given. And you are tech savvy people, Google on your own, find out, read on your own, find out. I talked about workshop the other day. Find out all the group leaders. How many group leaders are here? Yeah, all the group leaders take the onus on you. You want to develop your leadership skill? Do I take it? Correct? So all the leaders, please take the onus onto you to find out and delegate these duties onto the members. All right? Okay? You hold workshops among yourselves on on all these platforms, Google Meet, Google Form, how to conduct a workshop, and then do it. Take onus of your own studies. Right? You know what is education? Education begins only when you show your interest. You have shown your interest coming to this field, so now you have to, next step is to get involved. If you are not involved, you will not be educated. You have to involve yourself on your own progress. Is it clear? Is it clear to you?
Yes, ma'am.
Yeah, so I expect
Yes,
this
ma'am.
behavior from the next semester. I don't want any cheating. I don't want to find out. I will not tell you anything, but you will be debarred from appearing in the exam. As simple as that. All right? And self-directed learning is, again, starts from setting your own goal. But then you are not setting your own goal. We are setting the goal for you. But how you study is up to you. Interest is the first to education, then involvement, then effort. In the effort, you have to learn how to learn. How can you learn? That you have to explore and navigate. Clear? Clear to all of you? Yeah?
Yes, ma'am.
Okay. Then I leave you here and I will post this class in the Google Classroom. Whatever is written, you please study and find out more about it. After you have done, next week I'm going to put assignments, first set of assignments on this, okay? And then you will get back to me after 1 week. Okay?
Yes, ma'am.
Bye, ma'am.
Bye. Have a nice day.